Medicare mini course day 5, graduation day. So we've made it through the basic parts of Medicare. Hopefully you've watched the other parts of the mini course, and we're trying to piece everything together as easy as we can. So I'm going to keep everything simple. Right now we're going to talk about Medicare drug plans. And Medicare drug plans, I could do an entire mini course on. They are more complicated than the other pieces of Medicare, but we're going to try and keep it as simple because it's important to understand how they work so that we know how to get what's going to work for us. So I'm Keith Armbrecht, founder of Medicare on Video, and I help people across the country make the right Medicare choices. I can absolutely help you as well. Hopefully you'll allow me to help you. There's no cost to use my services, and that's how I make my living, helping with Medicare supplement plans. So I'm going to go through this right now and show you exactly what you need to know about Medicare Part D. Something else you will find helpful if you're coming into Medicare, or even if you're already there, is a copy of my book, Medicare Made Clear. I put a lot of time and effort into this book, and I'm giving it away for free. So you can see here, it covers just about every piece of Medicare. It even has videos in the book where I explain everything. It has all the links on where to get the things you need and how to sign up, things like that. So take just a minute, medicareonvideo.com/free book. You can download it right now, and it's yours to keep. I hope you find it very helpful. Medicare Part D, drug plans. One of the things they actually lined up with the letter is D is for drug plans. So is it mandatory? And the answer is no. You do not have to have a drug plan. However, if you don't get one when you're first eligible and then you want to get one later, you can. It's a little complicated, but there's also a penalty. But it's always kind of a tough choice. If you don't take any prescription drugs currently, should you buy a Medicare drug plan? And there are different opinions on that. I likely would not. Even though there's a penalty later, you likely will save more in premium when you don't need it than what the penalty is going to cost you down the road if you do need it. So that's a whole different conversation, but just important to understand most people do get it when they first come into Medicare, and you get a very low cost one if you're worried about a penalty later, even if you don't take prescription drugs now. So it's important to understand that. So how much does a Medicare drug plan cost? And again, premium can be as low as $750 a month. However, that's not going to cover a whole lot of prescription drugs. That might be one if you're worried about the penalty later and you want to just have one now. But the typical kind of standard Medicare drug plan, probably going to be about $20, $25 a month. So it's not an outrageous amount. It does have a deductible, and then it does have tiers and co-insurance levels. And again, it's more complicated, and we can help you with that and make sure you understand it and make sure we put it in place correctly. And then if we need to change later due to drugs changing, then we can do that as well. So right now there's a $480 deductible. That's a maximum. And then there's tiers 1, 2, 3, 4, and 5. You know, if you've had experience with your regular group health plan, you probably know how a tier 1 drug works and a tier 2 drug works. You know, it goes up in cost is basically about how it functions. So the coverage levels under Medicare drug plans are as follows. First, you have your deductible, where you're going to be responsible for your deductible before your plan's going to pay, and then it puts you into the initial coverage level. And that's where most people stay. So most people don't ever get out of the initial coverage level. But if you did, if you had a lot of drug use during the year, it might put you into what you heard is the donut hole, where there's a coverage gap. And only about 12% of the people ever get into the donut hole, but it's not a place you want to be. It's certainly less coverage in that donut hole. And then, God forbid, you're taking, massive amount of drugs during the year. You might reach the catastrophic level where things kind of come back to good coverage, but it's rare. Only about 4 people ever get to the catastrophic level, but you can get there if you're taking, cancer medication or something like that. So this is something we got to manage. We got to manage Medicare Part D plans to make sure they keep up with whatever your prescription drug scenario is. So you can change your drug plan at the end of each year. And when to enroll. The initial enrollment period is when you would jump in. So right when you start into Medicare, or there is that special enrollment period where if you enroll after age 65, so if you're retired, you come off a group plan that is when you would look to get into your Medicare supplement plan. And then when can you change? You can change at the end of each year. When you see all those billion of commercials on TV talking about Medicare Advantage stuff, that's also Medicare drug plan open enrollment is when you can change your Medicare drug plan. You have to make your choice between October 15th and December 7th. It goes into effect on January 1st. This says July, but it's actually January 1st. So it's something we got to look at every year to make sure that if your drugs change, that we can change everything for the better in a drug plan. So that kind of gives you a pretty good overview on Medicare drug plans. And again, graduation day. So we're done with the mini course. Certainly, if you have questions, if there's anything that we can do to help, that's what we do, is we help with Medicare. So hope you found this helpful. Have a fantastic day. Hey, don't go anywhere. These are some of my most recent videos right here. You can also find the link right below this video to download my book, Medicare Made Clear, absolutely free. You can also subscribe to my channel right here. So please download my book, watch some videos, subscribe to the channel. Have a great day.